I mean, I placed the ad because I need a family doctor.
It's that simple for Gary Shuster, who suffers from a metabolic disorder so rare he carries around these information cards about the disease should he fall ill.
Emergency room doctors typically have no or little experience with fatty acid oxidation disorders.
His condition, CPT2 deficiency, needs consistent monitoring, something that disappeared when his family doctor retired. Efforts to find a new doctor have so far led to long wait lists. So he placed this ad offering $5,000 to anyone who can help him find a suitable family doctor near his home in downtown Vancouver.
Need someone who's capable of tracking the disease, understanding it. Typically, if I have to see a doctor I'm not familiar with, the first 10 minutes of that session is explaining what the disease is.
An estimated 1 million British Columbians are without a family doctor. Last week, the province announced $118 million in stopgap funding to support the sector, while a new fee structure is negotiated with physicians. But that won't help Shuster find the help he needs now.
This is truly sad, but again, indicative of how bad the healthcare crisis is on the ground. I hope one of my colleagues can, and I'm sure they will, someone will try to make room for him. Nobody should ever have to put an ad in the paper.
As a dual Canadian-U.S. citizen, Shuster's considered buying private health insurance across the border and finding a doctor in Washington state.
We know the battle ahead will be long.
But he believes in public health care. Even fought for it while living in California before moving to Vancouver after Donald Trump became president.
I actively worked on the Obama campaign in 2008 precisely because he was promising to deliver a Canadian-like system.
So it's not lost on Shuster how his $5,000 incentive undermines the very system he believes in.
I think it's terrible that I'm able to do that and others can't. It's unfair. It's not how the system was supposed to be built. But at the same time, I have young kids, and if something were to happen to me, it would really be a disaster for them.
As of Wednesday afternoon, 2 people who don't want payment had responded to the ad. Karen Larson, CBC News, Vancouver.